Well, aloha everyone, and welcome back to Human Nutrition here at Chaminade University. We are still delving into Unit 14. This will be Unit 14B, where we talk about the life cycle nutrition for older adults. So, the learning outcomes for this chapter include discussing the demographics of aging in America, and we're going to discuss why Americans tend to be living longer than they used to. Talk about bodily changes that occur as a result of the aging process, and we'll talk about the nutrient needs of older adults, as well as some of the nutritional related concerns that are common to elderly adults. We'll talk about social, economic, and psychological factors that can affect the health of older Americans, namely that oftentimes they don't have the economic viability to be able to bring in enough income to help meet their nutritional demands. We will also talk about the risk factors of something called hypertension, or higher blood pressure, and different types of dietary interventions that we can implement to help control high blood pressure. All right, so the lifespan of the human body is approximately 120 years old, and life expectancy has changed quite dramatically between 1900 and 2008. So in the early 1900s, men were expected to live to about 46 years, women about 48 years. Now we live about 76 for men and 81 for women. And that means that we have encountered a whole new slew of age-related effects. So as we get older, we have some severe physical and psychological changes that occur and eventually lead to the death of the organism. And this is known as senescence or aging. And Americans' population has gotten older and older and more diverse. So in America, currently, 1 in 8 adults is aged over 65 years. I would assume that COVID has probably changed these numbers just a little bit, unfortunately. So we're lengthening the lifespan of the individuals by changing access to healthcare and disease prevention and increasing the level of education, as well as research and advances in healthcare and technology. All of this has helped us lead to better management of diseases. And we've also got a pretty good handle on infectious diseases. Again, COVID probably throws this slide in that face. However, that does mean that overall, that the amount of individuals who have been exposed to the promotion of a healthy lifestyle has increased. And as we've gotten older, the leading cause of death has now changed. So at this point in 2010, the main leading cause of death is going to be resulting from diseases such as heart disease, respiratory diseases, and cancer. And all of these arise from lifelong behaviors, things like smoking, low physical activity, poor diet, or overuse of alcohol. All of these can increase the risk of these major health conditions. Now, as we age, we can do so more or less gracefully, I guess, depending on our genetic factors, our environmental factors, and our lifestyle factors. So some individuals just have better genetics that have a better rate of body maintenance, and that can help us stave off or increase or decrease, basically, the risk of our chronic diseases. However, our environment plays a pretty large role as well. We have constant subjection to oxidative stress, and oxidative stress can cause damage to your cells. And your diet and activity choices also impact the rate of aging. So if you eat more healthily and you are more physically active, you can stave off senescence a little bit longer. And those individuals who are subjected to prolonged stress can also age more rapidly. And this brings me to something called the physiological age versus the chronological age. And when I say someone might age more rapidly than someone else that is the same age, now I'm talking about their physiological age. So chronological age is how old you are, right? Your actual years of life. But the physiological age is based on the body health and function of your body. So someone who is ailing and is very sick might have a higher physiological age than their chronological age, and someone who is very, very healthy might have a higher chronological age than their physiological age. All right? And as we age, we can end up with what's called sarcopenia. This is an unfortunate loss of lean tissue and muscle mass as we age. So here's a young adult's thigh. You can see this would be muscle, that would be fats. And here's an older adult's thigh. This is muscle, and that is fat. So as we get older, we end up losing muscle, which ends up with a decrease in our strength as well. And this is something that results from decreased physical activity. So we're able to stave off the sarcopenia if we maintain physical activity as we age. Additionally, as we get older, the abdominal fat tends to increase, so we end up with more deposits of fat, and we lose bone density as well as height. So you can see here, if we're looking at the bone, here's bone density of a younger adult. Here's the bone density of an elderly adult. And so all of these factors together lead to a change in the body composition of individuals as we get older. Additionally, we have a change in our immune function. So as we age, our immune system starts to decrease, which increases our risk of inflammatory diseases. And that means that the nutritional intake of older adults needs to be adequate to meet the immune response needs. So older adults need to have they often are intaking too low levels of zinc, iron, beta-carotene, folic acid, and multiple vitamins A, B12, C, D, and E, etc. So older adults want to make sure that they're supplementing or making sure that their diet does meet the needs for all of these chemical compounds so that we can maintain an adequate immune response. If we end up too low in any of these, we can end up with immune deficiencies. Additionally, our gastrointestinal lining is going to change a little bit. That means that we're not going to be bringing in as much food. That's going to lower the absorption of certain nutrients, meaning that we're not able to get the most bang for our buck in terms of what we're eating. Also, sometimes we can end up with lower amounts of saliva, which means that swallowing can be more difficult. And additionally, as we age, we enter into an increased risk for tooth decay and gum disease. And obviously, if we have pain in our mouth or a lack of teeth, this can cause an issue with mastication or the process of chewing. It also means that we might be severely limiting our caloric intake if it hurts to chew. So oftentimes elderly adults who just haven't mentioned that they're having tooth problems or can't get the words out, they would benefit from, say, switching to a shake instead of having actual meals. Again, missing teeth, dentures make chewing difficult. That's going to limit their food choices. And if we're limiting food choices such that there were only soft foods, we might only be eating, say, mashed potatoes instead of also figuring out a way to get some meats in there. So you want to make sure that you can get all of the different parts of the diet in either a liquid or a mashable form. Additionally, during transit, the digestive tract is actually making less hydrochloric acid and less of a protein called pepsin, which is a protein that breaks down proteins, an enzyme that breaks down proteins inside the stomach. And that means that we're going to have a lower absorption of multiple nutrients, including B12. So as we get older, we want to make sure that we're taking exogenous B12. Also, we have lower gastrointestinal mobility. And with less gastrointestinal churning, we have lower absorption of the nutrients. That means that more food is going to pass through into the waste undigested, meaning that we're not going to get all of the nutritional value that we could be getting out of the food that we're consuming. Additionally, as we get older, we have loss of brain function. It can include things like memory loss associated with age, which could be compounded into something called Alzheimer's disease or dementia. Dementia is a side effect of Alzheimer's disease. And that means that elderly individuals are less likely to be able to take care of themselves properly, which means that with cognitive decline, they're going to be able to perform less tasks or maybe perform those tasks more slowly. So if you give them adequate time, they're going to be able to perform those tasks, but they might not have enough time in the day to be able to get through all of the things that they should normally be doing. So that means that elderly adults need someone to check in on them and also to make sure that they're getting their nutritional needs. As we get older, our metabolism starts to slow down. That means we end up with loss of muscle mass, which I talked about, sarcopenia. And we also are typically going to have less physical activity. And that means that we're going to need less kcal. That means that we should have approximately 10 fewer kcal per year for men and 7 fewer kcal per year for women. But because the energy needs are going to be less doesn't mean the nutritional needs are going to be less. So we should be reducing kcal intake, but not reducing nutrient density. So we want to make sure we want to increase the nutrient density such that the food that we're eating is still meeting our nutritional demands, even though we're eating a lower amount of kcal. So this can be tricky. These are the recommended daily guidelines for your protein consumption, about 0.8 grams per kilogram of body weight. So that means about 56 grams per day or 46 grams per day, depending on your sex. It should be about 10 to 35% of your kcal, and this will help stave off tissue loss, muscle loss, and bone loss. And individuals who have suffered physical trauma or are sick or sickly are going to need higher amounts of this protein, again, because absorption rates might not be the same. Older adults should consume more complex carbohydrates than younger adults, so we should be about 45 to 65% of our kilocalories. And the emphasis should be on the complex carbohydrates as opposed to the simple sugars. So we want to eat more fiber and less simple sugars. Men that are 50 and more should be about 31 grams of fiber, and women 51 and older should have about 21 grams of fiber in their daily intake. So let's talk about fluid. Hydration is super important, and individuals who end up dehydrated can exhibit symptoms that mimic dementia. And this can be a problem for elderly adults because they're written off simply as being addled or just mentally incompetent. But really, they're suffering from something quite simple, as deficiency of water. So, hydration is super important, especially once adults hit 85, because at this point, the thirst mechanism decreases. So, they don't necessarily recognize that they're thirsty. And because they're moving more slowly, they might not eventually get around to drinking. And there are certain medications, and obviously elderly adults are more likely to be on medication in general, and certain medications cause the body to lose water. So any medications that are a diuretic means that we need to make sure that that individual is consuming more water to compensate. As adults age, the urinary incontinence increases, which is another reason why individuals might not be getting their liquid needs. They might be too concerned about accidentally wetting their pants or wetting the bed, etc. So we want to make sure that they are getting their nutrient needs, even if that means that they are suffering from incontinence. Because dehydration can be very bad, not only for your immune system and for all the different metabolism in your body, but it can also lead to constipation. So we should be drinking about 13 cups of fluid per day, which is going to include things like water and low-fat or skim milk. Remember, we want to try to limit the fat consumption for these individuals because their calorie needs are lower. All right, so your fat should be about 20 to 35% of your kcals. And you should make sure you're intaking omega-6, omega-3, and that very low amounts of trans fats are consumed. You should be focusing on your fish oils, like your omega-3 fatty acids, which come from fish, and also your monounsaturated and polyunsaturated fats. So really you want to make sure you're eating mainly unsaturated fats as opposed to trans fats, which I know are unsaturated, but they're the wrong type of unsaturated. And obviously you don't want to be eating very many saturated fats either. We need to make sure we're consuming adequate amounts of vitamin A, vitamin D, and vitamin B12. These are going to be different from the dietary requirements for healthy, normal, average-age adults. And vitamin A can actually be a problem if we end up ingesting too much of it. It can increase the risk of osteoporosis, and given that these individuals are already at a higher risk of osteoporosis, you want to make sure that you are consuming the correct amount, but not too much, of vitamin A. Additionally, we're going to be wanting to intake more vitamin D because as we age, we get less ability to synthesize vitamin D ourselves. We normally will synthesize it by the sunshine hitting our skin. And as we get older, we'll have less ability to do this. And we also, at the same time, so not only are we able to create less, but we also absorb less. So we lose the ability to absorb and convert vitamin D in the intestines and kidneys, which means that we're going to double our requirements of vitamin D intake at age 50 and triple those requirements at age 60. So more than likely, we're not going to be able to physically consume the amount of vitamin D from the food, and we're going to need to supplement vitamin D in order to meet these requirements, especially after we pass age 60. Vitamin B12 is very important, and a lot of people, once they reach 50, about 30% of people are not able to absorb natural B12 anymore because they have a low amount of stomach acid secretion, and it's going to be something that's normally absorbed in the stomach. Now, we're able to absorb synthetic B12, so if you're taking a synthetic like a vitamin, you're able to do that. But you want to make sure that you are getting in enough of your vitamin B12 to be able to absorb and use it in your metabolism, as inadequate B12 is linked to an increased risk of heart disease. So making sure that you have adequate levels of B12 can lower your cysteine levels. It's a particular type of amino acids, which can help reduce your risk of heart disease. As we get older, you want to make sure we're taking in adequate levels of iron and zinc. Over 10% of older adults are deficient in iron, and 25% of older adults are not meeting their daily zinc requirements. Now, iron deficiency can be caused by a couple things. By a deficiency in your diet, generally, but it can also be caused by blood losses. So individuals that are suffering from injury and repair can also be low in iron because obviously iron is found in the blood in the form of hemoglobin in your blood cells. So zinc is very important as well, particularly for your immune system. And if we have low amounts of zinc, we can end up with a low appetite and also the inability to taste certain foods. So a zinc deficiency can actually be kind of a feed-forward mechanism to have individuals eat less and less. So if individuals are suffering from just an apathy towards food, perhaps it's a zinc deficiency, and therefore maybe we can restore their appetite and restore their taste function if we can get their zinc levels back up. That means that we want to try to eat foods that are fortified in zinc and add supplements to the diet. Again, we're not going to be able to meet our zinc demands just by diet alone, particularly as we get older. Another thing that we're probably not going to be able to meet are our calcium demands unless we are going to be having at least 3 servings of daily a day. And typically, we're still going to need a calcium supplement in order to meet the needs. Approximately 70% of older adults are calcium deficient. And this is very, very upsetting because calcium deficiency is directly linked to osteoporosis. And the older you get, the less amount of absorption of calcium you're able to undergo. So if you picture that you have osteoclasts and osteoblasts, which are specialty cells that are building up your bone and breaking down your bone constantly. And they're all doing that by depositing calcium into the bone bank or removing calcium from the bone bank. Well, as you get older, you are absorbing less and less, which means you're depositing less, but you're still making the withdrawals of that calcium, which means that you can end up in osteoporotic conditions pretty easily. So the recommendations for older adults are that we're going to get at least 3 servings of daily a day, and additionally take a calcium supplement. Older adults also need less sodium than younger adults. You should limit your sodium intake to about 1,500 or less per day to help reduce the risk of high blood pressure. Sodium is directly linked to what's called hypertension or high blood pressure conditions. So, what are we saying here? The overview is that you probably, as you get older, are going to be deficient in one or more of these nutrients. So the older adults are going to benefit dramatically from nutritional supplements. So the reason that people take supplements vary. You might have the intention of preventing a deficiency, which would also improve your health and hopefully delay your age-related diseases. And that means that you might be able to keep your physiological age lower than your chronological age if you're able to make sure that you're meeting your nutritional demands of your body. We do know that high-dose fish oils can help with lowering your triglycerides. The beta-carotene, vitamin E, and vitamin A can help increase mortality. So that means that you're able to increase the longevity, basically. So you want to make sure that you're consulting your healthcare provider when you're taking these supplements, but you want to make sure that you are meeting your nutritional demands. So it's possible that you might want to go in and get some biometrics done to talk about your nutritional status, and then maybe alter your nutritional demands or alter what you're intaking to be able to meet your nutritional demands by using nutritional supplements. So the overview here is that we want to make sure that we're consuming a diet that has a lot of variety in it, has a lot of nutrients, so highly nutrient dense and phytochemical dense, that's going to be healthy for our heart. So typically older adults are going to be ingesting diets that are too low in vegetables and too low in whole grains, and also too high in saturated fats, cholesterols, and sodium. This here is a table that's talking about different ways that you can modify your diet in order to fight age-related diseases. So individuals that are suffering from Alzheimer's disease and Parkinson's disease might benefit from a lot of antioxidants, vitamin C and E, carotenoids, etc., to help stave it off or benefit their mental clarity. Or Parkinson's, they don't suffer from mental problems, but they have shaking issues. So this might help stave off or reduce the symptoms of these disorders. Anemia is typically caused by too low iron, so taking iron, folate, vitamin B12, all of that can help stave off anemia. I'm not going to read each one of these, but the point is that any of these conditions are going to have a dietary link. And so if you want to try to fix some of these conditions or stave off these diseases, you might want to consider adding supplements to your diet. We're just going to continue on here again. I'm not going to read each of these to you, but each of these conditions is linked to different compounds or a deficiency in different compounds that might help offset that condition. All right, so when I said calories in, calories out, we have a big problem with many older adults in that activities are difficult. So they have something, as I mentioned, called sarcopenia, which is a loss of muscle tissue, which leads to loss of muscle function, which means that individuals might have difficulty being physically active. Over 60% of older adults have arthritis or joint inflammation, which can be associated with pain, stiffness, etc. And there's over 100 different types of this arthritis, which is like an autoimmune disorder, basically, where your joints are going to suffer from inflammation. We also have osteoarthritis. So arthritis is just inflammation of the joints, but osteoarthritis is a specific type of arthritis. Basically, it occurs when cartilage rubs down or wears down and disappears, oftentimes causing the bones to rub when there should be cartilage in between them, which can cause a loss of range of motion, severe pain, swelling. Typically, treatment is going to include exercises to help increase your flexibility and range of motion. Additionally, sometimes these individuals are suffering from obesity, and so their recommendations would be for a little bit of weight loss. Additionally, we can take dietary supplements like chondroitin sulfate, which is something that's found in cartilage, to help provide relief for individuals who have pain, particularly knee pain, is one that they believe that chondroitin sulfate is going to help with. Also, glucosamine is something you can take for that. Rheumatoid arthritis is a joint inflammation, so that's just what arthritis means, inflammation in the joints. But this one might benefit from a diet that's rich in antioxidants, like vegetables, olive oil, etc., or fish. All of this can help prevent and manage your inflammatory response. Additionally, regular physical activity can help with reducing the joint pain, increasing flexibility and range of motion, increasing muscle mass, decreasing stiffness. So again, you want to make sure that you maintain regular physical exercise, but as you get older, you want to avoid high impact exercises. That means we're not going to tell an elderly person that they should be going for a jog every day. More than likely, what we're going to recommend is that they go for a swim, lower impact, water aerobics, etc. As we age, we also have a higher risk for what's called gout. Now, gout is a disease that results in swelling and inflammation that typically is caused by uric acid buildup in joints and soft tissues. Now, that uric acid is going to crystallize and become kind of sharp and can cause serious pain when people move around. And the very first symptom of gout is going to be pain in the big toe. And then typically that's going to be the first spot where uric acid kind of builds up in the soft tissues. Some risk factors are going to include obesity, chronic diseases, kidney diseases. So kidney diseases is going to be where we're going to end up with high levels of excess uric acid in the first place, as well as excessive alcohol intake, and family history can play a role in this as well. Now, we're able to manage individuals who suffer from gout, but there's no real treatment per se. Management involves exercise and weight control, limiting alcohol, particularly beer, as well as making sure that your diet is more heart healthy. But last but not least, there's this purine molecule that we want to try to limit. Things like meat and poultry and seafood are very high in the purine molecule, so you want to try to avoid foods that are high in purine so that you can help offset the gout symptoms. Another condition that affects many older adults includes osteoporosis. Osteoporosis is going to be a degradation of the bone material, which can affect multiple different places. Typically, it's going to be found affecting the spine, so you can end up with a vertebrae that can end up crushed or thinner. Often this means an individual is going to become shorter because the vertebrae are going to become contracted a little bit. And that means that individuals are going to have a harder time with bending, reaching, stretching, also walking. All of these things can become more difficult. And last but not least, they become more prone to fractures when they fall. Actually, it's been determined that a lot of the osteoporotic breaks are actually a break that happens simply by the weight of the individual standing. So we think, oh, help, I've fallen and broken my hip. But really, typically what happens is they break their hip and then they fall because they have broken their bone, which means that oftentimes you'll have compound fractures because the break will occur and then shove into the surrounding muscle tissue. So these individuals are very prone to injury, particularly to bone breaks and fractures. And some treatments are going to include consuming extra calcium and vitamin D, as well as inducing weight-bearing exercise. Remember, the more weight that you put on the bones, the more the bones grow. And we also have medications that can help stave off the calcium loss in the bones. Another disease that affects elderly adults disproportionately to younger adults is age-related macular degeneration. And this is going to be something that can cause blindness. So it's basically a slow degeneration of a region of the eye. We can also have cataracts, which is a very common disorder of the elderly, but fortunately very treatable. They just send a laser in to pull the cataract out, and oftentimes they'll put an artificial lens on top. So they might even remove the lens if we have a problem, but sometimes they can just suck the cataract out itself. But basically, this is going to be a bunch of proteins that are going to form aggregates above the lens of the eye, which cloud over the eye. If you picture you have a window that over years gets smudged with fingerprints and more fingerprints, and nobody wipes it down, eventually you have difficulty seeing through that window. And that's basically what happens when we form cataracts. They're actually going to be visible from the outside, and again, fairly reasonably easy to treat with modern medicine. Another concern here is that we want to make sure that we're eating enough antioxidants. Antioxidants and phytochemicals, which typically come from your fruits and vegetables, can help stave off cataracts, and other age-related eye disorders. Another effect for adults that elderly adults includes dementia and other mental disorders like Alzheimer's disease, which is a common form of dementia. And dementia is just defined as an individual who is suffering from problems with memory, learning, or mental stability. And sometimes this can also affect range of emotions. It can affect their cognitive time frame. So they might see their granddaughter or great granddaughter and think that they are their children, or they might see their child and believe them to be their long dead spouse, because they don't necessarily know exactly what year it is or what decade it is. Now, Alzheimer's disease is a very common form of dementia, but there are other forms of dementia that can be caused simply from dehydration, for example. But Alzheimer's is going to be an irreversible dementia. It's going to be actual destruction of brain tissues that are caused by plaques that are formed. It can also destroy the nerve cells as well as the brain tissue, so we can end up with kind of holes or caverns in the brain that used to be filled with healthy brain tissue. So some causes of Alzheimer's, it can include things like free radical disorders and inflammation, as well as physical and mental inactivity. So not using your brain for long periods of time, meaning that it doesn't necessarily hold onto. So performing memory exercises can be good for these individuals, even just sending them to the grocery store with a grocery list that they have to work through. And they also can be affected by smoking and chronic diseases. So typically, though, Alzheimer's is going to be something that is genetically related. So individuals who have a propensity for Alzheimer's disease and the buildup of plaques in the brain are more likely to suffer from this disease if their parents or their grandparents suffered from it. All right, another issue that affects older adults is socioeconomic problems. As we get older, our income levels tend to decrease, and almost 100% of American households that have elders are going to experience what we call food insecurity. So maybe not issues with actually providing the food, but not necessarily knowing that you're going to be able to provide the food tomorrow. It's a chronic lack of insufficient food. So food insecurity means that you might have food for today, but you're not sure that you'll have food for tomorrow. And even if they do have the right amount of income to be able to afford the food, sometimes they might not have the physical means to acquire it or to prepare it or even to consume the food as they get older, or especially if they're suffering from dementia, they might forget that they're hungry because they start to have less and less of a hunger response. So food insecurity is something that many elderly adult Americans suffer from. Some of the psychological problems that can occur as we get older can include things like grief, depression, and loneliness. If all of the people that we know and love have either passed on or have stopped contacting us because they've had their own life, that can cause some serious problems, including adult depression. Over 20% of adults that are elderly adults are going to experience depression, and a lot of those causes have to do with the loss of their friends and their loved ones, and maybe chronic pain problems or concern about their own health or financial distress. And typically symptoms of grief and depression are going to include a lack of appetite, which means that you're then going to end up nutritionally at a nutritional deficit, which can further exacerbate the emotional problem, because depression can be also caused by nutritional deficits. So if you enter into an emotional problem where you have depression occurring and then you further compound that by not eating properly, then you can end up exacerbating the problem. And so some treatment here is probably going to involve seeking professional help, actual counseling, and also dietary consult might help as well. And being in contact with friends and families, having neighbors or friends and families coming to visit can really help. It's been a serious problem here with the whole Zoom era when the elderly adults are not able to interact with their loved ones physically. But I swear we will get through this. Within the next 6 months, we will be back to normal. All right, so thank you guys so much for listening to my lecture today. I really appreciate your time. Happy studying and aloha.